Good evening. I am Professor Rajmohan, currently from School of Public Health, Kerala University of Health Sciences. And this is one of the monthly updates, public health updates, which the school is conducting regularly. And this time we have selected a topic, health equity and climate changes. And I wholeheartedly welcome all the participants, including the resource persons available in this platform. I should mention few names. In fact, the Honorable Vice Chancellor is not available because of some other preoccupied programs. So we can start the program. And I wholeheartedly welcome Dr. Migdad Asaria, Assistant Professor from Department of Health Policy, London School of Economics. And the session will be chaired by our Ramamurthy sir. We have also few other resource persons to give their valuable speech. Dr. Agash Srivastava, Additional Director and Head, Center for Environmental Health and Occupational Health, Climate Change and Health National Program on Climate Change and Human Health, National Center for Disease Control, Delhi. Then we have Purnamida Dasgupta, Chair, Professor and Head, Environmental Economist Unit, Institute of Economic Growth, University of Delhi. Then our own in-house faculty, Sairu Philip, who is a veteran public health expert and community medicine professor, now Principal Government Medical College, Pariyaram. Dr. Joy Elaman, who is a public health academician as well as an activist, who is now Member State Disaster Management Authority. And our moderator is Dr. Binoy, who is a public health expert working currently with the State Health Services. I think this is a very important topic because health equity and climate change is the latest thing on health policy academics of global importance. In fact, the extremes of climate events affect, also all of you know the extremes of climate event affects producing considerable disequities or inequities. And the most vulnerable and the most weakest always suffer the more. Whether it is a climate change or it is other socio-economic inequities or pandemics or other disasters, whatever it is always the so-called less miserables who suffer the maximum. So let us listen to the international experts, and after the talk chaired by Ramamurthy sir, we will go to the next sessions, including the panel session. And I request Dr. Binoy to take over and control the proceedings of today's academic session. Dr. Binoy, over to Binoy.
Yes, sir. Yes, sir.
Thank you very much, Binoy. Thank you.
Good evening, sir. Good evening, all, and thank you, sir. Our session for today is health equity and climate change, and we are lucky to have Dr. Migdad Asaria, Assistant Professor, Department of Health Policy from London School of Economics and Political Science, UK. Dr. Migdad is a health economist with extensive experience in both academic and policy making settings. His research interests include health inequalities and health financing, with a popular focus on health systems in India as well as in UK. He currently holds a fellowship from the Health Foundation to investigate the contribution of austerity policies to racial and socio-economic health inequalities, a grant from MRC to investigate the impacts of early interventions on inequalities in health and well-being over the life course, and a grant from NIHR to develop methods for accounting for unmet needs in healthcare funding formulas. He also employs methods from health econometrics, social epidemiology, micro simulation, modeling, and cost-effective analysis in his research. So over to you, Dr. Migdad.
Thank you so much, Dr. Binoy, and all of you for the invitation to speak to you. So let me just share a slide. So what I'm going to do is I'm going to maybe just outline the contours of this kind of discussion around health equity and climate change. And I'll focus a little bit more on the climate change side than on the health side, because I think most of us here are from a public health kind of background. So maybe more just to get everybody up to speed on the climate change side, and then just a few thoughts about how health equity and climate change are interacting, and then hopefully from the panel discussion we'll get a much more nuanced debate about what we can do about it. How does this discussion apply in India? So I'll give us so kind of the broad outline so that we're all on the same page, hopefully, and then let's see where we go from there. So I'll speak for about 25 minutes, 20 to 25 minutes. So I'll start by just talking a little bit about climate change in general, and then very briefly touch on, I think we're mostly familiar with these, but on the impacts of climate change on health, the impacts of inequality on health, and then how these two things interact in the kind of between each other. And then just outline a few ideas about going forward, what we need to start thinking about. So let's start with climate change, right? So this is, I've taken a few graphics from something called the Global Carbon Project. So the Global Carbon Project is a group of academics who study climate change, and particularly greenhouse gas emissions and how they're produced and where they're produced. And so this is, I think, quite a informative picture. So this is showing the carbon dioxide emissions or fossil fuel emissions over time from 1960 till now. And so as we all know, carbon dioxide or fossil fuel emissions are the primary kind of driver of climate change, right? And so as we can see, and these are showing the kind of annual emissions globally. And as we can see, whatever happens in the world doesn't really seem to impact these very much. You know, like they basically increase every year upon the previous year, right? So we can see we started off in 1960 producing about 2 gigatons, and now we're producing about 10 gigatons. We saw very small dips during COVID, where basically everything closed down, and we were still managing to produce huge amounts of carbon dioxide, right? Or burning these fossil fuels. And so this kind of just puts kind of into perspective, this is our trajectory. What it looks like is that every year we're consuming more fossil fuels than in the previous year, and we're producing more and more carbon dioxide, and even quite significant global events. The end of the Soviet Union or the OPEC crises, etc., didn't really shift this trajectory in any significant way, right? Now, one of the things we can think about when we think about these fossil fuel emissions or carbon dioxide emissions is a carbon budget, that there's a certain amount of carbon dioxide we can put into the world, and beyond that, we start getting catastrophic effects, right? And this carbon dioxide, when we put it into the world, it either is absorbed by the sea, or it's absorbed by the forests, or if it's more than the forests and the sea can absorb, it goes up into the atmosphere. And when it goes up into the atmosphere, it stays there, right? And so, and in our human kind of timeframes, it basically stays there forever, right? It doesn't go away by itself. So unless we somehow take it out of the atmosphere, it stays up there. And so any carbon dioxide we produced historically that's been too much for the oceans or the trees to absorb is still up there, right? And so this graph shows historically from 1850 until now, how much carbon dioxide different parts of the world have been producing. So you can see ever since the Europeans colonized America, they've produced the most carbon dioxide overall, and closely followed by Europe, and then China, Russia, UK. And you can see India is up there. It's fairly modest, especially when you take into consideration its population. It's produced less carbon dioxide in those 150 or so years than the UK has, right? So this gives you kind of a historical view of who's been polluting the atmosphere and causing global warming, right? And if we look a little bit more closely at particular countries, this is the aggregate emissions per country. We can see, I mean, you can see this interesting trend for China, where by year 2000, suddenly China starts to go up from 2000 to onwards. And you can see at the same time, the emissions of the most polluting countries, which were the USA and Europe, starts to go down at the same time. And this is the point where China joined the World Trade Organization. So effectively, the Europeans and Americans started offshoring, outsourcing their manufacturing and their carbon emissions to China. China produced things and then started selling them back to Europe and America. So it's not quite fair to look at China in this way. But we can see India has kind of been steadily going up, and now most recently it's overtaken the EU in terms of its carbon emissions, right? Of course, when we look at this per capita, when you adjust for the population, we see India goes all the way back down there. But still, we see similar trends. The USA is up there at the top. And so this kind of just gives us a picture of what's going on in the world, who's been creating this carbon dioxide, okay? If we zoom in a little bit more on India, we can see what in India is creating carbon dioxide, and it's largely burning coal for electricity, industry. That's what's contributing a lot, and you can see this is going up quite rapidly now as the country develops. And despite all of the talk about renewables and solar, etc., you can see that actually a lot of that development is being driven by burning of coal. Okay, so the world has kind of come up with a plan. So every year they have these COP meetings that you may have heard of. There was just one that passed in November in Baku, Azerbaijan. And every few years, the IPCC creates these reports to decide what should we do as a planet to deal with climate change. And so as I said, now we've got to this point where we're producing more carbon than the natural sinks, the oceans and forests can absorb. So it's going into the atmosphere and it's causing the world to warm up, okay? So one of the kind of most significant of these COP meetings was in 2015 in Paris, where it was decided amongst all of the countries that were there that what we need to do is we need to make sure that we don't let the world warm up to more than 1.5 degrees above pre-industrial temperatures, right? Because after 1.5 degrees, things will get really bad. We'll have lots of climate catastrophes, and because the climate is this very complex ecological system, you can start triggering irreversible tipping points, right? And so, so one of the things about climate change is that it kind of triggers these feedback loops. So if you think about one of the most kind of commonly talked about ones is where if it gets too warm, then the Arctic and Antarctic ice caps start to melt. And the Arctic and Antarctic ice caps are big huge white areas of land that reflect back lots of sunshine. So when they melt, first of all, they release lots of carbon that's trapped in the ice. Secondly, they stop reflecting all that sunlight back, and so that warms up the Earth even more. That causes more warming, that causes more melting. So these kind of tipping points that are largely irreversible reinforce each other, and climate change starts to run away. So once you get beyond a certain point, and nobody knows exactly what that point is, but scientists are very worried when temperatures go above 1.5 degrees, then we expect suddenly the temperatures will start increasing much faster than they even have been. But people think, but actually, in order to fix this, we'll have to do something quite drastic. and change our economies and the way we live quite dramatically, and we're not quite ready for that. So let's not worry about it and carry on doing what we're doing, and then we'll figure out how to deal with the effects later and reverse them. So that's the kind of idea, right? And so the official plan that they've come up with is that we'll pump up, essentially we'll pump up sulfur dioxide into the atmosphere. So they've noticed that when big volcanoes erupt, like if you remember, I guess it was about 30 years ago when Mount Pinatubo erupted, that reduced global temperatures by having these big clouds of sulfur dioxide in the air that basically reflected back the sun and cooled the earth. So the plan is, actually, we could artificially create these volcanoes, just pump sulfur dioxide into the air, and that will block out the sun and reduce warming, right? So we can do that for a while. And while we're doing that, we'll transition from fossil fuels to clean energy sources. And then what we'll do is we'll plant lots and lots of trees, and those trees will suck up the carbon from the atmosphere that we've put into the atmosphere, and then we'll burn those trees and capture the carbon as we burn them. Now, when they calculate how many trees, how much space you'll need, the kind of back of the envelope calculator says you need about land about 3 times the size of the total land mass of India in order to do this, to capture the carbon that we're already producing. And that needs to be arable land, so it's going to replace farmland and food production. So this is quite a huge and untested idea, right? And as we'll see, all of these have important implications on health and livelihoods, particularly the health and livelihoods of the poor and marginalized. So this is not some conspiracy theory. This is Plan A that the world has come up with on how to deal with climate change, right? And so if you look at the IPCC reports, these are the kind of official scientific, globally agreed reports on climate change. This is one of the key figures that they have, right? So this black line that we see, that's the one that we were looking at before to say that how is carbon consumption, or how much carbon dioxide are we producing year on year? And these green, blue, and red lines show what we would need to do from now on in order to reach 1.5 degrees of warming, which we said is the kind of maximum that we are willing to bear, 1.7 degrees and 2 degrees, right? And you can see we would basically need to stop producing carbon dioxide now, or cut it down dramatically so that by 2035 we're producing none. And that's quite a big ask, right? So if I remind you of this picture, there's nothing in this picture that suggests we're going to start massively decreasing our amount of carbon dioxide production anytime soon, right? So it's quite a worrying, right? Looking at these two pictures together to see, like, look, this is what we need to do to save ourselves, and this is what we are doing, right? And this is not new information. This is things that we've known for at least 20 or 30 years quite well, right? So, and if you look at the kind of science internally within oil companies, they've known this far longer. So this is something that we've known about but aren't doing anything about. Okay? And one of the big kind of debates around this is this idea of common but differentiated responsibility. So if we saw that actually certain parts of the world have been historically using up all of this carbon budget, they've been creating all of the pollution. So yes, climate change is a global problem, but some people have more responsibility for causing it than others, and so maybe they should also be doing more to fix it, right? And this is, so we've seen this a lot in the debate, and and this has been raised a lot, particularly by Indian policymakers, to say, look, India hasn't historically produced very much carbon dioxide. India needs to develop as a country, and in order to develop, right now it needs to burn coal, because that's how the economy is structured. And in order to, and if we are to burn this much coal, we want to have our historical share of that carbon budget, okay? And this is not a new argument. This was famously made in 1972 by Indira Gandhi. There was also this very influential report by Anil Agarwal and Sunita Narayan in 1991, where they identify this as a problem, and they talk about the difference between survival emissions and luxury emissions. And they're saying that, look, some people need to burn carbon just to live, right? Just to have enough food and energy to survive. And other people are just wasting those resources by flying their private jets and doing ridiculous things. And so we need to distinguish between these two different types of uses of the remaining carbon budget, right? And we need to think about this both globally. So, and this global kind of conversation has been often going on between low and middle income countries and high income countries. And we also need to think within countries about a similar debate. So we'll talk about that a little bit more, right? But I think importantly, what we need to remember is that climate change is disproportionately caused by the consumption of rich countries and rich people, right? And the negative impacts of climate change are disproportionately experienced by poor countries and poor people. Okay, so I think this is important, and we are at this kind of point where we're really seeing those impacts starting to come out, and so any kind of any wasteful production of carbon is actually now really costing people's lives, right? So let's talk very briefly about the impacts of climate change on health. Yeah. So yeah. So you all will know this. Seeing this day to day. Climate change is having huge health impacts in what we call natural disasters, but natural in some ways, but they're really
please mute.
being caused by or amplified by the kind of actions that we are taking. And so heat waves, storms, cyclones, hurricanes, flooding and landslides, the spread of infectious diseases in areas where they previously weren't spreading, droughts, water shortages, crop failure, famine, air pollution, wildfires, all these kind of things that we're seeing increasingly frequently, things that we may have seen previously, but we're seeing them more frequently. They're being much more severe than we would have otherwise seen. You often hear newspaper reports saying this was a once in a 500-year event, and then the next day another once in a 500-year event, and every day we're seeing once in 500-year events. So we're really changing the world in such a way that these things are having huge impacts, right? And so those are on in terms of natural disasters. And also, of course, we have these kind of longer term impacts of this ecological breakdown. And so we see things like air pollution, which both harms people in the long run, but also closes down schools and various other things, increasing in all sorts of different chronic diseases due to heat as well as pollution, mental health impacts, malnutrition and starvation as the food system is impacted by drought and water shortages. And we're seeing a lot of also conflict and displacement in different parts of the world, which obviously has a serious impact on people's lives. All right, so these are kind of the direct impacts of climate change that we're already seeing in many parts of the world, right? And now let's switch a little bit to talk about inequality. And again, this is something I assume many of you will be very familiar with, being public health people. But we have this, often we talk in terms of this social determinants of health. And this is kind of the famous Dahlgren and Whitehead rainbow model. You know, and so often when non-health people think of health, they think about healthcare and access to healthcare. And that's not really what creates health, right? Health is produced by everything, right? So within our general social and cultural environment, our health is shaped, right? And it's shaped by agriculture and the food we can eat, our education, our working conditions, our living conditions, water and sanitation, housing, all of these things that make up our lives make us healthy. And it's only when all of these things fail and we get sick that we need to interact with the healthcare system. And by that point, it's almost too late to be healthy, right? So health is kind of made up of all of these things. And when there's inequalities in society, these things are distributed unequally and people have different health, right? And fundamentally, the biggest reason why we care about inequalities or climate change is because it harms people's lives, it kills people, it makes them sick, they live shorter and less good lives, right? And so fundamentally, that's as human beings, that's what we care about. And health inequalities causes some people to live shorter and less well lives than others. Okay, and so that's what we get from the social determinants of health conversation, right? And so as we said, there's a whole range of conditions that shape people's lives, and inequalities in these determinants of health lead to unequal outcomes, right? And so these work through differential power and resources, differential exposure to conditions, differential vulnerability to things we're exposed to, and differential consequences of being sick. So all of these things reinforce each other. And so we see that inequalities in society are reflected in inequalities in health, in, very generally, nothing to do with climate change necessarily, just overall. Anytime we see inequalities in society, we see inequalities in health, and you see lots of studies that show the life expectancy of the poor versus the rich, or the life expectancy of lower caste versus higher caste, or the life expectancy of Black people in America versus white people, etc. Right? So all of these things are shaping health inequalities, right? And inequalities are intersectional, right? So you can think about not just one aspect, but you can think about how all these different aspects interact with each other. So if you think about a rich woman versus a poor woman, or a high caste versus a lower caste, or a Muslim versus a Hindu versus a Christian, or etc. All of these things, and then you take a low caste Hindu woman who has low income and compare. So you can see how all of these different things can independently shape your health, but also interact with each other to shape your health and your social determinants of health. Okay. And now thinking about inequality in India, one of the kind of interesting or sad statistics is India has the highest number of poor people in the world. Now, it is the most populous country in the world, so maybe not that surprising. And it has the third highest number of billionaires, okay? And society is quite unequal, right? So the wealth of the top 1% is 4 times the wealth of the poorest 70%, right? So there's a big skew of wealth and consumption towards the top 1% of society, okay? So now let's talk a little bit about the interaction between climate change, inequality, and health. So when we tackle climate change, we think in terms of what do we do about it, right? And so one of the things we think about is, okay, right now things are happening, floods are happening, heat waves are happening. What are we doing right now to kind of protect ourselves or to adapt to these conditions that are hitting us right now, right? And so that we call adaptation. The next thing we think about is, okay, this thing might not happen right now, but it might be coming very soon. It might be coming in the next year. How can we build resilience and prepare for these upcoming events, right? And the kind of larger kind of thing that we can think about is, how do we stop climate change? How do we stop contributing to climate change? How do we, clean up our carbon production and move our kind of economies towards green energy, et cetera, right? And so these 3 elements, adaptation, resilience, which are kind of very interlinked, and then mitigation, are things that we need to think about when we're thinking about our responses to climate change, okay? And so if we take adaptation and resilience together, so as we heard at the beginning, marginalized people have the greatest exposure to the impacts of climate change because of their precarious living and working conditions, right? And so if you're doing manual labor, or you're out in the sun during a heat wave, or you're living in a slum and there's a flooding or there's a landslide and you happen to be in the cheapest part of town, which is the one which is most exposed, then you're going to be the one who gets hit first and hardest by climate change, okay? And marginalized people also have the least access to resources in order to adapt to the dangers posed by climate change, right? And so just to take a very kind of superficial example, if you're in a heat wave and you have an air conditioner, you can just sit inside with your air conditioner and you're largely kind of protected from the immediate impacts of that heat wave. Whereas if you're a person who doesn't have electricity and an air conditioner and access to all of these things, then you're unable to adapt to that, and you have to try and make sure that you don't overheat, and there can be significant health and consequences for you, right? And so you can't adapt in this, and there's myriad different ways that you can adapt to different conditions. And the more resources you have, be it social capital or economic capital, the more you're able to adapt to these things, right? And so the more marginalized you are, the more you're impacted both by the direct impacts of climate change, but also on the impacts of climate change on the social determinants of health. So if you think about during a heat wave, if you're a poor person doing, I don't know, manual labor, say you're riding a cycle rickshaw or something, and it's too hot and you don't work, then you don't earn any money that day, right? And you can't work because there's no way for you to adapt because you don't have air conditioning in your cycle rickshaw, obviously, and you don't have, but it's too dangerous for you to work because if you do the cycling, then you may collapse and die. And so you lose out, and then you lose that money for the day, and then you're unable to feed yourself or your children, and then your body gets weaker, and you have to compromise other things, and then you become even less resilient to the impacts of climate change. And there's this kind of vicious cycle, right? Whereas if it's too hot and I don't work, first of all, I can go to work, turn on my AC. Secondly, if I don't work, I still get paid. Like everybody understands that, a professor doesn't work well. I mean, obviously they're doing something important, so we'll pay them. And so you can see how differently different people's living conditions protect them or impact them, and how they impact them both directly in the impacts of climate change, but also indirectly through these social determinants of health, right? And of course, the more marginalized you are, the less able you are to advocate for policy to protect yourself and your interests. And so you don't have necessarily friends who are policymakers, or you're not able to lobby for your opinions, right? And so this is the adaptation, right? And then in terms of mitigation, of course, we should do everything we can to reduce climate change, and we shouldn't also just give up because we say, oh, we're past 1.5 degrees, we may as well give up, because every increment in climate change will cause even more deaths and devastation and destruction, right? But we should also think about how we're doing this mitigation and how it makes different impacts on different people, right? And so we know this idea of development-induced displacement quite well from other kind of development stories, but one of the kind of interesting interlinked ones is this idea of dams and hydropower. And we've seen how that can destroy land and lives and livelihoods of people if not done intelligently. And we've seen a lot of the climate and social justice movements coalesce around some of these projects. These ideas of forests being important to capture carbon doesn't necessarily mean that you then exclude the indigenous people from the forest because you make them into a national park. And so we have to think carefully about how we do these mitigations. Similarly, as we roll out solar farms, they need large amounts of land. So where does that land come from? What about the people who are already using that land? How do we deal with it, right? We talked about this bioengineering, carbon capture and storage. Again, we need all of this land. Where is it going to come from? And we need to also think about the people. So as we're transitioning, we know that burning coal is very bad for the environment, but we also know lots and lots of people work in coal mining, and it's the poor and vulnerable people who are working in coal mining who we also need to think about as we transition away from coal. What are they going to do for jobs? What are they going to do for livelihoods? How are we going to transition in a just way, right? And so we need to think about all of these things when we're thinking about the interaction between climate change inequalities and health impacts, right? So yeah, climate change inequality causes climate change primarily due to the overconsumption of the rich, right? So who's causing this climate change? Primarily, it's people who are consuming large amounts of energy, whether it's by having huge houses or flying around in their private jets or all of these kind of activities, overconsumption, and it's very much skewed to the richest 1%, right? Climate change further exacerbates inequality by destroying the living conditions of those vulnerable, right, who are less resilient to its impacts and less able to adapt, right? And so you're already disadvantaged, and climate change happens, it might wipe out your house or wipe out your job or wipe out something, and you're even more disadvantaged. So there's this vicious cycle where climate change causes inequality, inequality causes climate change, and And climate change is also driving migration, where people have nothing left in where they're living. They're moving to other parts. But when you move somewhere as a migrant, you don't have the same rights as the people who live in particular places, particularly in cities. You often face exclusion, and you become even more vulnerable to the impacts of climate change, right? And that increased vulnerability increases your health impacts. So there's all of these things kind of feed into each other, into these vicious feedback loops, right? And as we've seen, poorly thought through mitigation actions can, of course, also have bad impacts on the lives and livelihoods of the marginalized. So all of these things are so interconnected and going in the same way. And we saw a preview of a lot of this when we had the COVID pandemic and the lockdowns following that, and we saw how it impacted different people differently. And that's kind of a small preview of this much bigger, longer term, more scary problem that we have in front of us, okay? So possible ways forward. So I'm going to just split this into one dealing with the symptoms, right? So we need to, well, climate change is already here and accelerating, right? So 2024 was the first year where global warming actually exceeded 1.5 degrees centigrade on average. It was, I think, 1.6 degrees. Now, it could have been a freak year, and so we need to take an average over a longer period of time, but we're definitely heading in the direction of exceeding this kind of threshold that we had set. And often when you're in high-income countries, you talk about climate change as something that might happen in the future, that we might have bad effects in 2050, but in actually most parts of the world, climate change is happening now, right? And you see the floods and the landslides and the heat waves and all of these things day after day, which we're not seeing so much in Europe, for example, but we're seeing that in large parts of the world. And so it's something that we need to deal with now, right? And so we need to find ways to adapt and build resilience in order to survive, right? Because it's happening and it's going to get worse and it's going to get faster and it's going to get more extreme. And so we really need to find ways to protect ourselves from it, right? And we, of course, also need to mitigate more climate change. And so we need to do both things, think both about how we're going to survive what's happening and how we're going to stop even worse things happening going forward, okay? And as we do this, we need to ensure that our actions on adaptation, resilience, and mitigation have a clear focus on the impact of marginalized population, those who have done least to create climate change and are suffering most from its impacts, right? So that's a kind of dealing with what's going on right now, right? And fundamentally, we've seen, so we saw with this idea of common but differentiated responsibilities that empire and capitalism lied at the heart of historical emissions, right? With colonial powers responsible for the vast majority of the problem in a historical sense, right? And we see even now capitalism and the inequality it perpetuates are continuing to drive climate change. And the overconsumption of the rich, both globally and within countries, is what's doing this, right? The rich countries and the rich people are just consuming far too much, and the world can't absorb all the pollution they're creating, and that's causing climate change, sorry. So the only way to truly tackle these interconnected problems is by tackling the economic system that drives both inequality and climate change, right? So we need to find a way to tackle this, and this will require rebalancing resources away and power away from the rich who are over-consuming and making these decisions, but they're not likely to surrender this power voluntarily, right? Because they suffer the least from climate change and they have the most to benefit from overconsumption, right? And so we are suffering the negative consequences of their greed, right? So as well as dealing with the unequal impacts of climate change on health, we also need to deal with the underlying inequality and social and economic systems that produce it while destroying our common home, right? So we need to really tackle this, right? And I'm going to finish with this quote from Frederick Jameson. It says, "It's easier to imagine the end of the world than the end of capitalism," right? Which is quite a scary thought, because actually it's kind of the choice that I think is presented to us. So I'll stop there.
Thank you so much, Dr. Mikdad, for your wonderful presentation. And it's my privilege to welcome Dr. Ramankutty V, who is chairing the session now. Sir is an Indian health economist and epidemiologist. He is also a recipient of many awards and honors, including the 1987 fellowship to Harvard School of Public Health from Ford Foundation. He has many publications in international peer-reviewed journals, and currently he is a research director, Center for Promotion of Research and Advanced Studies in Amala Institute of Medical Sciences, Thrissur, Kerala. Sir, inviting you for your valuable comments as we are chairing this session, sir. Over to you.
Thank you and good evening. I hope I'm audible. I am very happy to be here to chair this session by Dr. Mikdad, who's an old friend. He has been in India for a long time, and he was initially working with the ICMR for initiating the health technology assessment program in India, and that is how we came to Kerala. And we conducted a workshop together, and we had several interactions. So I know his interest in this topic of inequity. And later we also interacted a lot on the internet during the time of COVID, when we had a lot of discussions on various problems. He has, in a very short time, he has put the problem in very, very clear, succinct terms. Of course, we all know what is the issue, but only thing is we really don't know how to go about it. At least we know, but how to get there is getting tougher and tougher. So I think now I don't have anything to add. Of course, it is all very, very, very well put. So I will just not take any time, and I will ask anyone who has any comments or questions or clarifications to raise their point with Dr. Mikdad.
If anybody is having any queries, kindly shoot.
Vinay, we can continue the session. Those who have queries may please put it in the chat box.
So there is one question. Please explain NP. What is that?
That will be answered by the next panelist, sir. That is National Program for Climate Change and Human Health.
Okay.
So maybe he will be able to tell it after the next talk. Yeah.
And there
is a comment more or less that is from K. Rajashekaran Nair, sir. And it is he's telling that he's agreeing with your framework. However, the problem is many of these are still conjunctural and a lack of evidence. And that is the strength of those causative agents. And of course, methodological issues.
Maybe I can just quickly respond to that. So I think there's been
yeah, please.
So there's been a lot of work, particularly by the oil companies, to discredit that climate change even exists. And we see people like Donald Trump still happily say on a global scale, there's no such thing as climate change. It's not happening. It's not. But I don't think anybody in the scientific community doubts, and you can see international consensus in all of these IPCC reports, all of the things that I've put in front of you, all of the graphs I've put in front of you, the kind of graphs that the whole of the scientific community is very has consensus on. So none of this is kind of radical or conspiratorial or conjectural. This is all. Now, of course, you can say, oh, maybe some of these things may have happened anyway. We had floods before. But if we just think about the frequency and the severity of these things, you can't have a once in a 500-year event every day for a year, because it just doesn't make sense, right? The probabilities don't add up. So I think there's a lot of work to try and continue business as usual, continue the economy in the way it is, because a lot of people have interests in this short-term benefit, but that's going to have a lot of long-term harm for us. And I think trying to prove to people that it actually exists while it's happening in front of you is probably not a wise use of time at this point. There's far more urgent things that we need to focus.
Thank you. Actually, there is one more question. What is the impact of climate change in vector-borne diseases?
So I'm sure many of you will know this much more than me, but from a non-kind of clinical perspective, I can say that you can see a lot of diseases, a lot of places are becoming much more favorable to diseases that were previously not. So diseases like malaria and dengue and things are spreading in places where historically we didn't see them, because now as the world warms up and the environment reshapes, those are becoming much more able to survive in these places. I mean, the other quite interesting thing that I read about recently is that as the Arctic ice caps are melting, there's things that are trapped in the ice from thousands and millions of years ago that are coming out that we haven't experienced for a long time as humanity, but these things are now coming out, and they are again being circulated amongst communities and killing people, and we don't have immunity to them because we haven't been exposed for so long to them. So there's all sorts of interesting and scary things that we don't even think about and emerge on us, along with just these diseases just becoming spreading to areas that we didn't know about. So yeah, both historical and geographical interesting.
Thank you so much, sir. And I also thank Dr. Ramankutty, sir, for chairing this session. And also I request you both to kindly stay because if any more questions are coming up, maybe we can take it up at the end of the session. Now let us move to the panel discussion, from challenges to solutions, advancing health equity in the face of climate change. I would like to introduce our panelists for the day. And first of all, I would like to introduce our panel lead, Dr. Akash Srivastava, who is Additional Director and Head for the Center for Environmental Health and Occupational Health in Climate Change and Health. He is also the National Program Officer for National Program for Climate Change and Human Health in National Center for Disease Control, Ministry of Health, Government of India, New Delhi. Sir, over to you. Sir, we would like to hear from you initially about your experience as National Program Officer and the New Year initiative of your department in context of health equity.
Thank you, Dr. Binoy. I'd also like to thank the Kerala University of Health Sciences for giving me this opportunity to be here. It was very nice to hear from Dr. Miqdad Asaria and how elaborately he put forward how climate change and inequity are related. And I'll just be adding a few comments first on the presentation that he had. It's very true that from the international perspective, India has been facing a very unjust scenario because of how the developed countries are addressing the issues of climate change as of this moment. And India has constantly been voicing and raising its voice against, voicing its concerns about it. Even in the recent COP29, you all might have heard how India walked out when they were talking about climate finance and how inappropriately the countries from the developing countries were being asked to take a very little amount of money for them in context of climate finance. Coming to inequities have always been a problem. Yes, we are now moving towards, not moving towards, rather living in a capitalist world. Almost all of the countries are moving around the concept of capitalism. And as we heard in this presentation, we have a handful of billionaires who own more than what the rest of whole India earns, despite of the fact that India has such a huge population. So it automatically gives us an understanding how badly affected in terms of wealth are we. And then this specifically reflects when it comes to health. It's already a social sector, and if you're already living in an inequity, and then talk about social sector, it's largely going to affect you very seriously. I'm here looking after a new program in India, which is the National Program on Climate Change and Human Health. The genesis of this program is that somewhere in 2015, the Prime Minister's Council on Climate Change in India came to propose that we need a separate mission on health. And once that the mission was announced in 2015, there was an expert group that deliberated on what would that mission do, what would the vision of it. 3 years down the line, a national action plan on climate change and human health was developed for India. And by 2019, we had a national health program, a new national health program under the NHM umbrella, which is the National Program on Climate Change and Human Health, under which we, the center as well as the state governments, contribute towards ensuring that we are able to meet the targets that we annually agree upon in this program. This program has initially started to address some of the issues of climate change, despite we understand that climate change affects the entire spectrum of all communicable diseases, non-communicable diseases, mental health, everything that is relevant to human beings, and as well as also to the health infrastructure. But a lot of health programs already exist, and they probably just require to be tweaked to accommodate for climate change aspects. So this program primarily was trying to focus on what was previously not being addressed in India through a health program. So we, as of now, are addressing issues of air pollution, extreme heat, extreme weather events, and also what we call as green and climate resilient healthcare infrastructure. And then we're also trying to work now, after being 5 years in this program, to also try to address other issues with the existing health programs, as you said, for vector-borne diseases or waterborne diseases, etc. That would be the next step for us to go forward. Now, in this context of inequity, one of the important things that I would like to mention is there is something known as we need to do a risk assessment, climate health risk assessment. It's an important part of what requirement is for all programs set under the framework of how WHO tells countries to address it. And this risk assessment has got three components. It's got the component of exposure, the component of vulnerability, and component of adaptation. The exposure tells you how the hazards impact you. Vulnerability tells you about your own certain parameters like demography, etc., that might be relevant to your vulnerability. And then adaptive resources, what you may have to offset whatever impact that you might have. And when you talk about inequity, as was explained very nicely by Dr. Acharya in his slides, all these three factors get impacted by health inequities. So the problem is that if you are on the side where you are badly impacted in health inequity, that means the exposure is going to impact you more than others. You're going to be more vulnerable because of the vulnerability factors, and you would have less adaptive resources to even fight back your problem. So this is how your risk eventually goes higher. And this is what we noted when we undertook this risk assessment exercise for the country, how those parts of the country are at higher risk to others, which are also known to be in a bad shape when it comes to health inequity. In the program, we also realize that we need to pay special focus within the country on the vulnerable population. When I say vulnerable population, it means in socioeconomic terms, the people who are living in slums, as people who are from tribal villages, etc. In terms of demography, the gender, the women, the children, the elderly. In terms of occupation, the people who are exposed to these hazards more on account of the work that they do. A lot of agricultural workers and people who works in these coal mines or people who works in industries who are exposed to a lot of extreme heat, all beyond what the nature provides in terms of the wrath of heat that we face in summers. And then geography, the locations like people living in mountains, people living in islands. They also are exposed to inequitable amount of exposures, as well as they have a lot of inequities in terms of vulnerability and adaptive resources. So we have noted that we need in our program to be consistently taking into account. So whatever we do, for example, when we work towards creating awareness, we should ensure that we are addressing these populations. So these populations should know what this climate change is impacting them on. And when we're talking about building capacities of our health systems, then also we see that we try to first pay attention to those states which need more attention. And we also try, in terms of the solutions that we provide, to be more sustainable in nature, more local in nature. It is talking about building resilient healthcare infrastructure. We've proposed that they should use local materials that are sustainable in nature instead of going for commercial products. And talk about nutrition, we also again encourage using local produce, local that brings in less impact on climate change. So in all the ways that we work in the program, we've always tried to understand the question of inequity and how to address them. One of the comments that came about the point that it's a matter of there is lack of evidence, and of course there are issues of methodological matter. I would just like to say that for every common man, it's visible to their eyes. I've worked as a public health professional for so many years at National Center for Disease Control, and used to be the part of the teams that used to go to response to disaster situation. Over these years, what I have seen is what used to be just 1 or 2 or 3 calls a year for me, over the years became much more frequent. So that's what is it. That's the truth in which we are living today. The disasters are happening all over us. We all during the summers are experiencing extreme heat. These heat goes on till the month of November to be experienced in many parts of the country. We don't no longer experience early winter that used to be experienced in parts of the country like North Delhi, northern part of the country like Delhi. So all of those is just, we don't really need some papers or methodological work for anyone to get convinced. And so climate change is a truth, a reality that now everyone can experience. And as Dr. Sayo was saying, that we've already breached 1.5 in 2024 summers. Once you breach 1.5, you all know we are in not the good side of climate change. So broadly, that's what I try to explain about what my program is and what we are doing in context of climate change and equity. Thank you again. And I would like other members also to express their views. Thank you.
Thank you so much, sir. Sir, we would like to take one more perspective from your side that actually the national program is named as National Program for Climate Change and Human Health. So when we are talking about One Health, do you think that this human health may be replaced by, by perspective of One Health approach? What is your opinion on that?
Okay. Now, in global context, when they talk about One Health approach, it's an approach. It basically means that you should try to see with the same lens the entire aspect comprehensively of health. That includes the issues of human health, animal health, plant health, the environment that plays a role in between them. All of that is One Health approach. It's basically about addressing all things together. That's what is One Health approach. On the other sense, when I say about One Health, that term came up, I'm not saying about approach now, One Health. That term came up when they were talking about COVID, when they were talking about how zoonotic diseases have become more prevalent at this of time. And they were talking about exactly how human health and animal health needs to be brought together. Of course, there is a component of environment which plays between how the diseases are transmitted between humans and animals. So that's what has a role in One Health. But if you look around how the world is addressing One Health, you will see they are mostly talking about zoonosis. That's what they are talking about in One Health. So when you say One Health approach, that's fine. But when you say One Health, it primarily is more to talk about zoonosis. in one of the places that I read in somewhere was a very better explanation and a figure which showed that when you talk about things like climate change, it is more appropriate to term them under what you call planetary health than in terms of one health, because it's the planet versus the mankind, right? It's directly a fight between the planet and the mankind. So it's not only the indirect effects to other diseases, the direct effect as well. So I would rather be happy to call it planetary health than one health when I'm talking about climate change and health. Thank you.
Thank you so much, sir. And one more final thing is like this is common for all the panelists. Is there any future research areas which you can suggest? Sir, can you hear me?
Yes, you're asking this question for me?
Yes, sir. Is there any future areas in which we should do more research?
Well, if it comes to research, I will say we really need a lot of work to do, especially because, first of all, while there has been a lot of evidence globally, in India, we still need real good evidence of how climate impacts human health. I'm not talking in terms of the linkages, but I'm talking in terms of the magnitude, to real know in the numbers how much of health impact is attributed to climate change, because that is important for planning purposes. If we know what is the magnitude of impact today, then we'll be able to put a baseline and then work towards ensuring that over 3 years of plan or 5 years of plan, where do we expect to reach and what we need to do. So that's where one of the important things that in India is not being addressed in research. People do small research here and there. Mostly they are all trying to create linkages. Linkages are well established. We don't really need to work on that. We really need to know numbers, magnitude of impact, especially in local context if we have policies to plan. The second important area is solution. We have to find solutions that work. You have to understand that it's not easy to say that it's happening. It's happening, but we need to also do something about it. And technology solutions that can help at a low cost factor for every man to be able to live if there is a question of inequity. I just can't find some expensive solution, like if we talk about a fancy air conditioner or a cooling tower in a building. Tell me, where does the majority of the India works? Will it be possible for them to live in buildings with cooling towers? No, it's not going to happen. So you have to find solutions. How are they going to be protected from the impact of harsh heat that they will face? When you talk about air pollution, there's practically no solution. Even though I am in the health sector, trying to write off advisories, telling my people avoid going out when the air quality is bad. I live in Delhi myself. For months, the air quality is poor, very poor. And then how do I tell my people that you don't earn your bread and butter? Please don't go out, don't do your job, sit at home. Especially the poor. How will they manage? The hawkers, the vendors, the rickshaw pullers. So affordable solutions which really work are needed. So a lot of research needs to be done in these areas. And I'm not sure how much would the Western world invest in these ideas, because this is not their reality. It's our reality. So it's we who have to wake up to the situation and think of how I'm going to invest in such research. Thank you.
Thank you so much, sir. We request you to stay, because if there are any more questions, then we can pick it up in a later stage. Now, moving on, I would like to introduce our next panelist, Professor Purnamida Das Gupta, ma'am. She is the chair, professor, and head, Environmental Economics Unit, Institute of Economic Growth, University of Delhi. Ma'am, can you just explain your work experience in connection with health equity? Over to you, ma'am.
Thank you very much. I'm not a health specialist in the sense that I do not come from a background in the health sciences. I'm more of an environmental economist who works at the interface of environment and health. Let's put it that way, or at least that's the way I got into health economics. But yes, I have been working on climate change issues and the interface with health and environment in general and how it interfaces with health. So first of all, thank you for inviting me. And it's been interesting to listen to both speakers, especially both the presentation on the various aspects of climate change. I think it was quite overwhelming in terms of the amount of information you were able to, Dr. Asaria was able to pack into his presentation. So hats off to him for doing that. And also the very wise remarks from Dr. Srivastava. So I was actually thinking, what else can I add? So I'm just going to add a few thoughts based on what I understand so far from my own research. So I'll start with climate change impacts. And the first thing in the context of equity, I'll try to restrain my comments to the context of equity. Now, the first thing that strikes me when I say equity is to recognize that impacts from climate change are also very varied. When we look at global statistics, we on say impacts or the amount of warming or the amount of sea level rise that we expect in different places, they convey one meaning. But when we try and get that down to a more granular level, even at the regional, national, subnational, whichever level we are looking at, it may be good to keep in mind that these impacts vary a lot by region, by the developmental context within which the impact is occurring, and so on and so forth. So the context really matters. So on one hand, physically, they differ. And on the other hand, how this impact is going to be manifested also differs. Of course, there's already been reference to the famous IPCC risks framing, therefore, diagram. So I think what matters is to move away from the impact itself to the notion of risk. So which are the communities at risk? Which are the geographic locations at risk? Which, as Dr. Srivastava said, is really an interplay of exposure levels, vulnerability, and the hazard. Now, and these come together to risk, and then, of course, you have the additional arm of response. Response itself is sometimes adequate and sometimes not adequate. Sometimes we know how to respond, sometimes there is uncertainty about how to respond, all of which constitutes a learning. So I think that's the first idea I have when I hear about climate change and equity. The second idea so some people are going to die from the same cyclone. Some people are not going to die. Some people are going to fall ill. Some people are not going to suffer the morbidity consequences. I would like to share with you some results from research that has been done over the last 20 years. So if you remember, there was this cyclone in Orissa, the super cyclone in 1999. Research suggested later, when we looked at the mortality statistics, this was done by a colleague of mine, it's published and well known, that there was a large proportion of deaths amongst better off. And the reason is that when the warnings went out, in whatever rudimentary form that they existed at that time, it was much easier for the poor, for those without assets, to leave behind what they had or to quickly pack up what they had and to carry it with them. And they moved to the schools and the hospitals and took shelter inland. Whereas those who had the assets and who had these strong houses stayed back because they felt that the impacts would not hit them. And there was a lot of mortality and morbidity when those houses just collapsed. So I'm using this as an example of how context matters. Our developmental context for the global south can really matter in some unexpected ways. But yes, all the time we try and protect ourselves. So ideally, the way forward is not always that clear cut. So we need also our share of development. So we build our infrastructure in both gray and green shades during what we call a transition phase. So that's the next idea I want to bring in terms of equity, that there is a transition. We talk about net zero. We have set a goal of 2070 in India. But the question is that there will be a transition phase. And this transition phase will also introduce us to ideas of equity. Maybe new forms of inequities that we are not prepared for as yet. Maybe there are forms of equity that maybe we will do well in some aspects and maybe we won't do so well in some aspects. But there will be these what we call transition risks, which will occur. So, for example, if we have a major change in the employment pattern, which comes out, which is induced by a change in investments that are going into the kind of industries that we see. Maybe we put it into the money goes into, say, a transition from, say, coal to, we know that the coal industry is a big employer. Apart from the emissions aspects, if there is transition, everybody is not going to get a green job. I find it very hard to believe that overnight you will retrain, reskill, and get everybody into the green economy. Ultimately, we do all hope we will get there. But during this phase, we will see transition. We have learned a lot from our experiences with migration. Migration and health equities has been another very rich area of research in India. And I think maybe there are lessons we can get from there. How are we going to face the transition risks? That's the second thing I think which will start mattering for equity. The third thing I want to really talk about is that what climate change, of course, is very big now. But the fact is that we also have a lot of learning today to understand that, access to food, water security, climate change, and biodiversity loss are all interconnected. So climate change has come as a further layer of interconnections across these things. So I think what we will have to also be conscious about is the fact that health and that all of these factors are going to pose threats to human health. And this is where I think we have to be careful in our decision-making processes as to how we wish to deliver on health. We have a lot of things on our health agenda, for example, universal health care. But if you start seeing universal health care in terms of all the contributions that I'm sure many people in this webinar also have made to the understanding, is that it is not very new. Some of these things are not very new. It's just that they have got enhanced. And the climate discourse has helped put it on the table more clearly. And we need to now integrate climate as well into the other things. So for instance, I take the case of pollution. So we've done a lot with ensuring food security in some sense, food grain production, food security. But by now we are seeing the consequences of of the need to manage how you produce food. Because because of the way we produce food, on one hand, you have more food. It is a very basic input into strengthening health. But how we produce that food and the kind of chemical pollution it has led to, chemicals we have used, the pollution it has resulted and has run off into water bodies, into land, into deteriorating soil health, and back into the very vegetables and fruits that we eat from that production is something that's turning back and now hitting health and raising health concerns. So I think there's this multiplicity of layering. And when I think of health equity, I like to think that it is not only climate change, but climate change in conjunction with all these other things, a lot of pre-existing concerns. And I think as a developing country, in this context where we do have a lot of disadvantages across different communities, we need to be sensitive as to the rest of it also coexisting and in our design for things. I do believe that solutions exist. It's a question of what kind of resources, what kind of investment we are able to get to put into those solutions to do better. And I think what has happened with the recent G20 and others is that we have managed to put, and I think India played a major leadership role in that, in putting both climate finance and the One Health agenda squarely as something that is big on the G20's agenda. So I think that's also a way forward in terms of defining international equity. One thing I will just sign off with this is that there are some things that we are doing. Perhaps we do not always recognize it in terms of climate change, but if we put it in this interactive framing across different elements, then we see it. I want to talk about, for instance, intercultural health services. The very fact that we are now more onboarded in terms of integrating Western systems of medicine with indigenous traditional knowledge systems, and we are moving forward on integrating these, is a realization that there is need for integration. The sustainable use of medicinal plants is another big example where India has set up conservation areas for trying to do this, because we know that there are multiple connections with things, including climate change and how we manage health risks from it. I will stop there, and thank you very much for inviting me once again.
Thank you so much for your inputs, ma'am. But before signing off, we would like to ask the last question for you. Actually, we measure the outcome normally as we are all human beings in terms of money. But as far as climate change is concerned, do you think that is there any other way of this economic metrics we need to think of, or do you think that this is enough? Or what is your opinion on this?
That's a very, very, very relevant question. Thank you. There are many metrics that are available. We all know that there are these large numbers floating around. There's one that the Nexus assessment has just come out with, that you have losses of some 10 to 25 trillion is the value of the losses going ahead from just these few interacting elements that I talked about. So this is the question of the costs, the damages, the unintended consequences of not onboarding these impacts in our decision making about managing health risks. And that is one dimension. But the reason why these go unaccounted in our systems is because we still don't have the metrics to value them well enough, nor are we always able to integrate them into standard measures of value. So there are two kinds of things. So there is monetary value, which we do not do well enough always. And that is where you hear all this talk of measuring beyond GDP metrics, which is now coming up, and creating satellite accounts so that we have better measures of the environmental degradation, which is to get the monetary value. And there is also the idea of there are certain things that till date, as far as I know, we do not have the tools to turn into monetary values. And that is also something that I, at least as an economist, would be the first person to accept. Even as we push the boundaries of what we can value, for example, we will never be able to value completely the benefits from encouraging intercultural health services. But we can possibly better value the damages that come from morbidity losses due to an extreme heat event. There will be some part of it we can't value, but there will be some parts that where we do have the techniques today to try and value. So I think that is what we can at best try to do. But even then, we there's a lot that we can do still, yes, but there will be some things we won't do. But at least we can value enough to set a minimum floor, which gives the call for action for us. And I have, for instance, tried to value inconvenience costs for women if they do not have access to proper sanitation facilities. And actually, one state government took up that study and decided to implement a costlier design of what appeared to be otherwise a costlier design of a toilet design. So there are examples. It's slow, but it's catching up. Thank you.
Thank you so much, ma'am. Now, I would like to invite our next panelist, Dr. Sairu Philip, ma'am. She is Professor of Community Medicine and Principal of Government Medical College, Pariyaram in Kannur, Kerala. Madam, you are well known for your advocacy for medical curriculum. So, according to you, what are the areas that need to be incorporated in the medical curriculum for health professionals to be trained? Over to you, ma'am.
Thank you, Dr. Binoy, for including me and for all the organizers for including me in this panel discussion. Now, before elaborating on what are the core areas to be included in the curriculum or why we need to include it in curriculum, I would just like to dwell upon why climate change becomes so important for health, why climate change becomes a fundamental threat to human health. One reason is we all know the increasing in scale, frequency, and intensity of these hazards. We are seeing it every day. It's not once in a blue moon phenomenon, as was beautifully explained by the speakers. So that is one reason why everyone, not only the medical students, but every one of us should know about climate change. Secondly, it is directly contributing to humanitarian emergencies like we see day to day. And the third thing, it is a threat multiplier. It reverses decades of health progress that we have made. And also we should remember that it is also jeopardizing the vision, our vision to achieve universal health coverage in terms of equity. And another thing is that intergenerational equity, that is also being a threat, because what we do now is going to be a threat for our future generations also. So these are the reasons why, including medical students, all of us should have an idea why climate change and inequity, all of them are so much linked together. Now, including in curriculum, actually now it doesn't form part of the core curriculum, but there are patches of it being mentioned. So definitely in the curriculum, we should include how climate change, why it is a fundamental threat to human health. Number two, how can, when you are knowledgeable about it, when you can anticipate about it, how you can deal better with care of your patients. For example, when you know that a heat wave is going on, the patients you see in your clinic, what is the extra thing, intuitive thing that you should carry in your mind? So things like that. So when there is somebody asked about vector-borne illness. So when there is increase in humidity and when the temperature is rising, that is the best time for mosquitoes to breed. And that is the time when you can anticipate dengue and all those vector-borne diseases, and you can be prepared. So these things, the medical students and the doctors should know. Another thing, whenever warning bells go, like saying that, okay, there is going to be some disaster or some climatic change. We need to counsel to our patients how to reduce the risk from that event. We get very salient points from the health services during that excess of heat time, what you should do and what you should not do. And again, even now, doctors are credible sources of information as per from the viewpoint of community. And maybe they are social messengers. So for all these reasons, this should be included in the curriculum, at least that knowledge part. And of course, the skill part is also important, and the attitude part is more important, but then how each one of us can contribute in our minimum way, not to increase the emissions. So all these things are important, and these are the areas I think there should be some core areas which should be introduced into the curriculum, and also the desirable areas which if some person is interested, they can go on. But overall, I believe that this should be a part of the curriculum, and of course, the current CBME, competency-based medical education, gives us enough opportunity to introduce it by way of electives or by way of what you call an integrated teaching, or in any way you feel it can be introduced. Thank you.
Thank you so much, ma'am. Now, moving on to the next panelist, Dr. Joy Ilaman is the member of Kerala Disaster Management Authority and former Director General at KILA, that is Kerala Institute of Local Administration. Sir, you are one of the key persons who had the experience of working closely with the local self-government in implementing vast number of government programs. So, can you put some light on how we can ensure health equity through this local self-government? Over to you, sir.
Thank you, Dr. Binoy and all others. Good evening. First of all, I have to actually think about this whole issue of health equity and climate change. But I think it is a double dose, actually, the inequity double dose. Climate change initiatives itself is actually inequity based, actually, and or it causes inequity. And then we are talking also about health inequity. You take the case of the global climate politics, right from various other conferences of parties, Paris, up to the recent 29th COP. What is the status? It is all about inequity and nothing about equity. That is why earlier speakers mentioned about the countries, the developed as well as the versus the developing and underdeveloped countries and other things. So it's all about inequities. The climate change initiatives itself causing, or climate change politics actually causing inequity. And when it comes to the national and other levels also, if you can think about all extreme events which has gone up in number, as well as various other climate change related impacts, are more on the impacts are more on the deprived and the marginalized. So that again is about inequity. Kerala, the state of Kerala has started experiencing the impacts of climate change, or understanding and accepting that climate change is there through various extreme events, and now which has become a regular feature. Now we are also moving into a heat era where the increased temperature and is going to cause a lot of impacts across the state, which a few years back we never thought it will happen to Kerala. So that is the stage where we are. And there again, if you can look at things, you will understand how the inequity sets in, both in terms of climate change itself, as well as in terms of health also. All these impacts, heat-related impacts also would actually serve. But I'm happy that the mention about social determinants of health. And so we accept that we cannot deal with health and health inequity just by clinical or medical approaches. whereas all our social determinants which were shown are all to do with development and governance. The same is the case with climate change also. If you are actually talking about mitigation as well as adaptation, or even the so-called terminology called the resilience, it is all about various other determinants. Climate change does not exist in itself. The initiatives on climate change doesn't exist by itself. It is all about development and various other determinants. So it is about development and governance. And that is where, if you want to address some of the issues with regard to inequities in both climate change as well as in health, we need to start talking about local actions. That is where the decentralization comes in. That is where the local governments come in. And Kerala has its own experiences, especially on the People's Plan campaign, the decentralized development planning exercise, which was started in 1996 and is still continuing, and where the local plans prepared by the local governments, if you look at the initial and the later events, you'll find that many of those things which were developed at the local level were addressing social determinants, and that has its positive impact on reducing inequities in health. That's how it's a proximate determinants of health. Most of them have dealt with. But we also have recent experiences where we had started working on local action plan on climate change, where because many of these impacts and many of these issues have to be dealt at the local level, whereas the global politics and global terminologies are all exist, but many actions have to happen at the local level, and where local action plan on climate change, where you look into the vulnerabilities, you look into the risks, you look into the hazards and all kinds of things, and then come up with local action plan on climate change, where many of the issues which you discussed earlier are dealt with one way or the other, not directly as health, but as social determinants, proximate determinants, and others. But we also have the local disaster management plan that again is linked to the local action plan on climate change, and all of them leading to development plans. That is where the People's Plan campaign comes in, where the local governments prepare their development plans, where the issues pointed out by the local disaster management plan as well as the local action plan on climate change, many of them get translated into action through the development plans which they prepare. So this is how, and it is governed by the local government, which means it is all about development and governance. And this is how the local issues are addressed, where the inequities are addressed in both health and climate change impacts. So these are all interconnected. That's how I say. I cannot talk just about health inequity or just about climate change related inequities, but it is all interconnected, and that is where we need to come up with a framework. That is how I said local disaster management plan, local action plan on climate change, and finally all of them lead to development plans and governance. That's how it is. And we in Kerala, if some of you might understand, in 2017 we started the Nava Kerala Karma Pathadi. That is actually the new Kerala, development of the new Kerala, where Kerala had achieved a lot of things, but then it's time for us to move further, and where we actually looked into education, livelihoods, housing, waste management, greening, water, and of course health. And people also had raised this question, why should we take health as a major issue when we are on top of the world with all kinds of indicators showing that we are on top of the world? But then our idea was that we need to move further, and our challenges are going to be second generation issues, where if we don't actually look at things at the moment, the marginalized can actually get left out. And that's how we started the Ardhram program, and where all our primary health centers got a revamp up to the level of the medical colleges. Things have started changing and addressing new issues of health at the local level. We have the demographic transition, we have the epidemiological transition with its own nuances and our own development challenges. But our experience during the COVID is the best example of how we actually treated both the all these issues, health inequities through the local planning and other things, where you can actually understand that our COVID management was totally equity oriented, where everyone was included. It was totally inclusive. It is not just about the rich and the poor and others, but it's also about various other stakeholder groups not being left out. It is like leave no one behind, where the elders are looked into, the differently able people are looked into, the children are looked into, the women are looked into, and this is how things emerged. And where there was also this health system already, as I said, had got revamped up to the local level, so that everyone is addressed, as well as local governments came into the fray, and they played a key role in bringing all these things together at the local level, so that this could be addressed. No one is left out. And the role of the community-based organization, like the Kudumbashree, that is the Federation of Women Neighborhood Groups, playing a major role at the local level, so that everyone is included. So this is a lesson to be learned, how actions at the local level, of course, through the local governments, as well as the various departments and sectors coming together, and the CBOs coming together, the local team coming together, and that is how we moved ahead. So we need to look into the inequities in both health and climate change, but in a more focused way, so that things happen at the local level. Thank you.
So thank you so much for your valid inputs. And now I would like to sum up because we have already crossed the 8:30. So it was a very vast session. So, but still, I try to be brief. And if something more has to be added, then I think Dr. Rajmohan sir will add. So, from Dr. Migdad Asaria's presentation, climate change is intensifying with carbon emissions surpassing natural sinks' capacity to absorb them, driving global warming. And the UN's COP21 set a 1.5 degrees Celsius warming limit, beyond which irreversible damage could occur. And proposed solutions like geoengineering, renewable energy transitions, and bioenergy with carbon capture are crucial, but can have significant impacts on health and livelihoods, particularly for marginalized groups. In countries like India, inequality is stark, with extreme wealth disparities and disproportionate impacts of climate change on the poor, worsened by social determinants of health. And climate change exacerbates inequality, leading to migration, increased vulnerability, and worsened health outcomes, especially for those least responsible for all its causes. The 2024 global warming milestone highlights the urgency for adaptation, resilience, and migration, particularly in low and middle income countries who face more immediate threats. And from Dr. Akash Srivastava's talk, he was explaining about how the national program for climate change has been emerged as a national program for India. And he also talked about the sustainable local solutions, the importance of it, and the comprehensive need to address the planetary health and the need evidence of impacts of climate change, which is required, and solutions for the current challenges in the local way, which is very much sustainable. And afterwards, we went to the next speaker, Professor Purnamita Dasgupta ma'am, and she was more or less talking about the inequalities in the impact of climate change and the intercultural health services and the matrix that is needed, and how current metrics in the economics can be used for assessing. She also talked about the migration and health and the importance of water security, biodiversity loss, and the problems which we are facing now. And moving on to the next speaker, we also heard from Dr. Dr. Sairuk Philip and she was always advocating for the medical curriculum, and she also stressed on the need of the fundamental what fundamental threat the human health is going to face. And as far as the doctors are concerned, they are all the authentic persons for giving this information, education, and communication for the public, and they can well take care of their patients if there are any climate related problems like heat related problems or acute respiratory illness or cardiovascular illness. And Dr. Joy Elements, the last speaker, he also stressed about the importance of incorporating the local action plan on climate change. And he also talked about the vulnerabilities, the hazards and risk, and the disaster management plan, which we are continuing to develop. And he also talked about the Navakerala Karma Paddhati, which the government has already established. And he also talked about the needs of inequality addressing and formation of this newer climate policies. So, sir, is over to you, Rajmohan, sir.
Thank you, Binoy, for a wonderful moderator function. And I take this opportunity to thank all the speakers, panelists, and participants equally, especially to our chief guest, Dr. Mikdad, and also Ramgude sir, then to our other panelists for all the erudite discussions and also contributions from their parts. The group present here is, though small, is a really committed group. So I hope the message will be well spread to others, because what we need is now action rather than mere academics without transfer to policy and action. So the people are continuing as helpless. That is a fact. As we already mentioned, the adverse effects of climate change is becoming more and more a reality. All extreme events are happening more frequently, and a lot of things are happening, which is all adverse to the health of the humans. So we need really action, and this may be a small initiative for a call for action among our academia, and subsequently to be spilled over to the other collectives. Thank you very much, and we hope we can see you all for the next public health updates. Thanks.